Hello, everyone. This is Dr. B from Steps to the Future, coming to you with another college and career conversations. This evening, my guest is Karen McLeod, who is a social worker. So I definitely hope that you will stay tuned and come and learn a few nuggets of information. One of the things I just wanted to point out to people, as you notice, as I've been doing these, I've been focusing on Black and Brown career professionals. This is part of my series called Representation Matters. I had a conversation probably sometime last year with one of my former colleagues, Richard Martin, who is a social studies teacher at East Providence High School. And Richard and I were having the conversation about the number of teachers of color in the classroom. And we were talking about when we had a teacher of color, and we were asking other people. So out of that conversation and out of a conversation I had with my youngest son, I decided that I wanted to focus this series on representation matters, because you can't be what you don't see. And I just want to make sure that students, Black and Brown students, see career professionals in different ways. So again, Dr. B, Steps to the Future, and we'll be back with you in about 15 seconds. So thank you, everyone. We are back, and we are here with my guest for this evening. I'd like to introduce you to Karen McLeod. Karen has a Bachelor of Science in Public Health Education and a Master of Social Work from Fayetteville State University. Go FSU. Yes, go Broncos. Karen, welcome to the show this evening.
Yes, thank you. Good evening, and thank you for having me.
Okay, so as you know, this is about introducing students to different types of careers. So first of all, tell me why did you decide? So first of all, let's talk about your degree in public health education. What made you decide to pursue a degree in that particular field?
So, in a roundabout way, I was attending college undergrad at North Carolina Central University, and I actually started off in a different major, and I decided after great consideration to transition to health education. It aligned a lot with what the curriculum was I already was taking, and then it also aligned with my interest in the medical field.
Okay.
And so then I connected with the department. I really enjoyed the faculty and staff. And one of my mentors, which now is a friend of mine, took me on and just embraced me. And she definitely inspired me and encouraged me to just get excited and begin my career journey in public health. And so during my undergraduate time at Central, I actually did an internship because that was a part of the curriculum. And I actually worked at a pregnancy support agency.
Okay.
And so there, the focus was really on connecting families, moms, and babies to resources and services in the community. And it was in Durham. And we also would assist with making sure that the families had diapers and clothes for the baby, all the essentials for a child. And then also making sure that mom was taken care of just as far as her prenatal care and understanding that piece. We would also do community outreach events. So getting the conversation started about sexual education in high schools and with groups. And so we would go into high schools and talk about sex education with the students there. And then we also formed support groups, assist with just encouraging students to make healthy choices. And so that just fueled my fire for public health education. And after I graduated in May of 2008, I actually came back to Fayetteville. I wanted to stay in Durham to work, but I had an opportunity to work here in Fayetteville in Cumberland County. And so I started my public health journey as a health educator at Cumberland County Health Department. And I worked primarily in health promotion. And so in health promotion, I really focused more on like healthy eating and exercise, some policy and environmental changes centered around those two concepts. But I also was able to do a lot of work similar to what I did during my internship. So there were classes that were offered at the health department for pregnant women. So I got a chance to actually teach some of those classes. And then I also got a chance to work in the community and do a wellness task force, and it was specific to teens. So to again establish that conversation about sex education, and then just really support teens during that time of their life when they're trying to figure out things, trying to figure out relationships.
Yeah.
And so I really enjoyed that.
Well, thank you. You know, I messed up there at the beginning. I when I looked back at my notes, I didn't realize that you went to North Carolina Central. So got to give them a shout out for producing, for doing what they do. Quite a few members of my husband's family are graduates of North Carolina Central. So we got to make sure that we give NCCU their due. So that's really important. You know, the other thing that I really liked that what you said was about having values that were aligned with healthcare and working with young folks, because sometimes I don't think people, when they're thinking about social work, they're not necessarily thinking of it as something in health related.
Right.
Whereas all of the work that you've been doing is definitely working toward having a healthier environment, a healthier life, helping people learn health tips and strategies in order to have a stronger family. So again, I really like that. So folks out there that are listening to this, social work is more than just the social services that we typically think about. So think about all of those healthcare initiatives that come about through social work.
Yeah.
So thank you so much for talking about that. And the other piece you talked about the community outreach. Can you talk a little bit more about that?
Yeah. So as well in public health is pretty much geared toward community outreach and looking at the community. And so though you do have folks that come in for services, the majority of the work is community related. And that's what I do love about public health, because you get a spin of both. And I really enjoy the community work. And so as a health educator and also as a social worker, a lot of what I do is out in the community, which I really enjoy. And I enjoy that because I like being around people. I love people and I love helping people. And I love being in the community. I think that when we are in the community, we can make some change because we get to know people where they are. And we get to see them in their environments. So I really appreciate the time that I have had being able to really get to know people on the ground and in communities, to really find out what their needs are, and to find out what their concerns and challenges are as well. I respect everyone that I come in contact with and their stories. I've had so many folks to share stories with me. And a lot of times I feel like I'm a sounding board too, just because a lot of people don't take time to hear other people's stories. And it's not necessarily that I have a lot to give, because I don't, but I'm there to listen and to validate them as a person and what they've gone through and what frustrates them, what challenges them, and try to work to see if we can, come up with a solution or come up with something that is going to be helpful for them. And so that's one thing that I enjoy about being in the community doing work.
Oh, that's fantastic. Folks, anybody that's listening in, please, let us know where you're from. If you have a comment, please let us know. Put it in the comment section and we'll answer, we'll get back to you. Also, if you have a question to ask Karen about social work, we're here today with Karen McLeod, who is a social worker. Actually, that's not her full title now, so I'll let her talk about her full title. But she has a degree in public health and a master's in social work. And that's what she's doing right now. Thank you, Kim Lifton, for joining us. Kim Lifton is a friend of mine who is in Michigan, right? Is it, Kim? You're in Michigan. And she has a comment here that she'd like to share with you, saying that, of course, you have a lot to give Karen. So, she's in Detroit. Okay. So thank you, Kim, for joining in. I appreciate that. Yeah, Karen does have a lot to give. You could just tell it from her, just from the small part that she's told us about her work for social work. Because it sounds to me, social work is the kind of field where you have to really enjoy what you're doing, because it seems, listening to people's stories, that it's tough.
Yeah, it can be, especially just knowing what people go through and what their experiences are. Just carrying that can be emotionally draining sometimes.
Yes.
And so being able to recognize that as well as a social worker and making sure that you do that, I'm very intentional about self-care.
Okay.
That's been something that I think that I have battled with, and a lot of social workers battle with challenge with that, just because we are emotional people and we want to definitely help, and sometimes we are put in circumstances and situations where we always can't help, but we can listen, and as I shared before, we can validate the situation. And so yeah, it's a rewarding career. I definitely have to say that. And one thing that I love about social work is that it's so broad. At first, and I think you mentioned this before, a lot of people do think that social workers just work at DSS, and a lot of times I have to. When I tell people what I do, I have to explain to them, like, I don't work at DSS and I don't take people's kids. I actually help with the family and the system and try to make things so that it's helpful to the parent or guardian. And we try to do our best to make sure that families stay together. And so the thing that I love about social work is it's so broad. There's so many areas you can go into. Again, I'm in public health. There's medical, social work. There are social workers that specifically focus on policy development, and we call those like social workers that don't practice clinically. We call those macro level social workers. So
Okay.
they do a lot of different other things. So again, I appreciate the profession and value all of what social workers do.
Okay, we have Debelina joining us from Cary, North Carolina, and she's saying thank you for what you do. And Debelina, I actually think I owe you an email, and you just jogged my memory. So I will have to get back to you, because I know you emailed me about something and I completely forgot. I am so sorry. Okay. So Kim is telling us that her sister had that type of job as a social worker in LA, and that it was so hard. So yeah, it is. And you're so right. People have this one view of what social work is. And
Mm-hmm.
it is just so much more. I know when I talk to other folks that are in social work, and the breadth and depth of what they do is absolutely amazing. So tell me about tell me about the work that you're doing now.
Well, so I do a lot now. So when I actually started in social work and as a professional social worker, I worked in the program that I currently am in now, which is called Care Coordination for Children, and we're going through a name change. And so it's referenced also as Care Management for At-Risk Children. And we primarily, our program is housed in all of the health departments in North Carolina. And it's a population management type care. And it really focuses on the family system and the child, making sure that the child's health and well-being are taken care of. So we look at the developmental challenges, if the child has those, or what developmental milestones they have. We also look at the health of the child to make sure that they are connected to a medical home or practicing physician, and making sure that they get to schedule like well child checks and have immunizations and things of that nature. So we have a team of social workers and nurses that do the work, and our nurses do a lot of social work too. Um, we use them more for their medical knowledge because in our program we do have a lot of medical fragile kids, and so as social workers we may not necessarily have the skills or understanding of some of the medical terminology, so we'll lean on our nurses for that. But typically, most of the medically fragile children that we have are already connected to the medical community, and they have a nurse or doctor that is specifically assigned to them, and they can understand their plan of care. And so we're there to support the family to ensure that they have the needed services and resources, and we connect with them after birth and until up into the age of 5.
Okay.
And so we're hoping by then, at the age of 5, that they have connected to the appropriate resource and service, and that, of course, that relationship has been built in that medical community, so that we are no longer needed. But if there's some additional support that's needed, we would have identified that before they turn 5, so that we can basically connect them with another care management service or case management service for them to further continue services. So I that's my full-time job. Right now, I don't have any kids on a case on my particular caseload because I actually supervise my team. And so my role right now is providing more managerial and supervision to my team, in handling other public health emergencies and things of that nature. And so, of course, COVID has been very something that we have been very instrumental in, and so that's taken a lot of time from most of staff, and so now we're slowly transitioning back into our roles, and so that has definitely been a unique experience, but we are appreciative of that as well. Not only do I do that, so I also am a part-time adjunct instructor at Fayetteville State University in the School of Social Work. And I actually teach a class specific to health and social work as well. So I get a chance to not only work in the area of what I do, but also teach specific to health and social work. And I really enjoy that. A lot of the students I teach our undergraduate students, and they have either an interest or just like a curiosity about medical or healthcare social work. And so I get excited just being able to share with them my experience, and then get those that are really considering some medical or public health career or journey. And I've had plenty of students that actually now work in more medical or public health arenas. And so that is always heartwarming to me to be able to experience that. Right now with work, I also am very involved with equity and inclusion type of work. I actually serve, and this is not so much so with work, but also personal and community related, but specific to social work, I serve as a member of the National Association of Social Workers, the North Carolina chapter, on their equity and inclusion committee. And then I also have been doing a lot of work in my profession in public health. in specific on the job. So in Durham County, we are very intentional about having conversations and looking at policies centered around equity and inclusion. And so we are also in the process of forming an equity and inclusion work group subcommittee in public health. And so I have been a part of that conversation as well. And that is hard work, but it also is rewarding. Just to be at the table and to use my space and my position to also influence policy decisions and just have a voice as well to share in what experiences that I've had. So I appreciate that too.
That is so good. So we have a question from Debelina. She wants to know, do you focus on specific counties in North Carolina?
So good, very good question. So yes, so with our program with the CC4C, I'll use that as an acronym, but for Care Coordination for Children. We do only focus on Durham County, but depending on the county to which you reside will depend on what health department would provide the service. So for example, like in Cary, Wake County would provide the same service similar to what we do in Durham, but in Wake County. So all of your counties, the health departments will have a program similar to mine and be more specific to that particular counties. Your smaller counties may have more of a regional health department. And when they have the regional departments, then they will focus on more than one county or community. Yeah.
Okay. All right. That's good. I love what you said when you talked about working with the North Carolina chapter of the National Association of Social Workers, because I'm always trying to encourage my students in their research on careers to look at some of the professional associations that are aligned with the career that they may be thinking about. I know sometimes there are junior chapters or high school chapters that students can get involved with. And even if they don't have those, just knowing that that exists so that when they go into college, that most likely there will be a student club or organization that might be affiliated with that particular association. I love what you were saying about being part of the Equity and Inclusion Committee, because that's a conversation that we're all having at all levels, everywhere. I know in all the organizations I belong to, that's a conversation. Earlier today, I teach part-time at Providence College virtually because it's in Rhode Island. So of course I'm here in North Carolina, but I teach virtually. And we're right now, by the next week, we have to have a diversity, equity, and inclusion webinar done. So actually a couple of webinars we have to do and go through them. And the conversations that are taking place, well, all virtually now because not too many people are on campus, have been really incredible. And some of them have been uncomfortable for people. Some of them have been very uncomfortable because some folks didn't recognize or didn't have to walk in these shoes of racism. So it's trying to educate themselves and at the same time figure out what it means to be an ally, to really be an ally. And I think some folks are, everybody's coming at this from their own space and have to figure out where they are in this work. But it is so important what you're doing to do that. Because, typically, the history of social work with Black and Brown folks, we were talking about that a little bit early. Would you want to talk about that a little bit?
Yeah. So I love what you said. I think it's important that we realize that we're all on the journey, and some of us are like, early adopters to the journey, and we are like on it. And then some of us are late adopters and we're just beginning the journey. And so I think that's important to recognize as well. But as we were discussing earlier, one thing that we really have taken time, especially with the National Association of Social Workers, the North Carolina chapter, and the association period, and recognizing that historically, social work has had its hand in perpetuating racism and white supremacy. When you look at the historical context of social work and how it came about, it really did produce harm in marginalized communities, in Black and Brown, and with Indigenous people. And so now, what we have to do is acknowledge that, because for so many years it hasn't been acknowledged. It's been, just dusted on the rug, and we continue to move forward. But now there's so much power in acknowledging things and acknowledging how we were or what we did and how we produced harm. And then how do we move forward from there? And so the association has been really intentional about just starting that conversation, and then also really acknowledging the harm that has been produced as a result historically of what has happened. And so I really appreciate that. And I appreciate the work and the journey that the association has started as a result of that. And I think it's going to be something that is not only intentional, but I think that it's also going to be something that we can see some very transformative results from, which is exciting to see and know. So I really appreciate just being again in the space, having a voice, and being a part of the movement, because it definitely is something that we want to recognize, and that we want to do a better job at being equitable and inclusive, especially for Black and Brown people, because that's not how it's been in the past.
Right. When I first got out of college, I didn't have a teaching job, and I worked for our social services in Rhode Island for 1 year. And the social worker that I was assigned to work with would do home visits, and a lot of times I would accompany him on the home visits. And we would do the home visits, and then we'd go back to the office and do a debriefing and go through the notes and stuff. And there were just so many things, there were so many policies in place that didn't seem like they were helpful to people.
Right.
It felt like they were doing everything to keep people at a certain poverty level. I remember one file we looked at, and looking at the generational cycle of families being, using social services and needing social services. But when you dug a little bit deeper and you looked at some of the structures that were in place, I used to say, well, how can they get out of this cycle?
Right.
Because the system really isn't helping them.
Right.
If you made $5 over a certain amount, then they took away your medical care, or they did this or did that. And I said, well, wait a minute. Why can't these people have, 6 months to a year to get on their feet, instead of, okay, that's it, you're cut off? Well, now you've just put them back.
Right.
A few steps. And I could never understand a system that supposedly was designed to help people was not helping people.
Right. Yeah. And that's an interesting point too, because I think we were talking before just about just how in your generation, back in the day, it was you all were very vocal with protests and activism, but now it's switched, and we see racism in a different form, and we see it more systemically. So in policies, in the way services are rendered, and we see that. And so what we are now trying to do is recognize that and make those changes and do it more from a policy standpoint. I think a lot of our issue is that I love a concept that I learned from a racial equity training that I went to. It's through the Racial Equity Institute, and it's in Greensboro, North Carolina. They use the concept of groundwater, lake, and fish. And so I love a statement that they make all the time. And they share with us, Like a lot of things that we do in state, federal, local government is fixing fish. And we can't fix fish. We have to fix the groundwater that the fish is in. Because until we fix the groundwater, we're just continuing to fix fish and not problems. We're not getting to the root cause of what that problem is. And so ever since that training that I've been to, and it's been multiple times that I've gone to the training, but that always like resonates in my mind, even the work that I do. Like, am I just fixing fish, or am I really doing something to make a substantial impact to where it's systemically showing that there's some change being made? So I think that, right now in the environment that we're in, that that's something that we definitely need to be mindful of, the work that we do.
I love that analogy. I really love that analogy. I'll have to look into that Racial Equity Institute. I've actually heard quite a few people talking about it and a lot of positive regard for it. So I guess that will be one thing I'll have to put on my list to do next.
Yes, it's an excellent training. They do a groundwater approach, which introduces you to the training. And then they have a 2-day, it's called a Racial Equity Phase 1 workshop. And you spend 2 days in talking about race, racism, white supremacy, what that looks like in the concepts of it historically. It will blow your mind. Indeed, it will. And you will then think about, okay, I understand now why that is the way that it is and why this is the way that it is. It will definitely like put things into perspective. Definitely.
Yeah. That is so true. I've been doing a lot of, I think a lot of people have a lot of reading around anti-racism, looking back at the history of systemic racism. And I guess what I didn't recognize is how embedded it is in healthcare. Now, as I read more, I just realize, racism is everywhere. It's in every system. But when you read about healthcare and you read about the, things like, somewhere along the line, physicians had gotten the idea that Black people had a higher tolerance for pain,
right,
than white folks. And I'm like, really? Are you serious? And or other things, when I read about experimentation that was done. That's why initially we saw so many Black and brown people reluctant to take the vaccine, to get a vaccination, because too many people, I know I'm one of them, remembered the Tuskegee experiment.
Right. Yeah.
And what happened there, and or the story of Henrietta Lacks and what happened with them appropriating her cells to do other things without permission from the family. Right. So there's been a history there. Yeah. So again, it was a little tough at first to even consider, okay, is this something that I want to do? Because based on the history of healthcare for Black and brown people in this country, I don't know about it, but finally, I did go through and completely vaccinated. So I'm glad about that. But it's those kinds of things. And I'm sure that in your work and working with families, especially, I love that you're working with the system, with the family system. And the family system is a microcosm of what's going on in their community. Right. And then what's going on, locally, what's going on statewide, what's going on nationally. So I'm sure in the work that you've done with folks, you run into those issues of healthcare and people reluctant to do certain things because of past transgressions.
Yeah. And then not only that, because some people may not necessarily be familiar with those, but just lived experiences too. Just there's so much mistrust, because a lot of times, of course, now in the medical community, you don't have people that look like us that are our doctors, our surgeons. You don't have many of those. And so a lot of times you do have predominantly a white system, and there's mistrust there because sometimes there's misinformation. Sometimes there's not enough education because the doctor is coming in or the medical provider is coming in and providing medical advice or medical information, and it may not be that the person understands, the receiver understands exactly what the medical provider is sharing. And then a lot of times the services are rushed, so they're not there to really spend time in sharing with the family or the patient like exactly what's going on. And if you're not a person that, a lot of us don't like to challenge medical providers. Some of us don't advocate well for ourselves, and so a lot of times we are either misdiagnosed or we go without being diagnosed, or we don't have those questions answered satisfactory like they should be. And so, and again, that's an unfortunate thing, but it's something that is happening in our society today. And I'll say at every income bracket too, especially with Black and Brown individuals. I remember in a meeting that I had with our Equity and Inclusion Committee, we were talking about experiences. And I had shared with the group, and this is not a personal experience, but something that I know statistically and I've heard from friends and colleagues, but especially for Black women, we are more likely actually during childbirth and childbirth age to die, regardless of our income level and educational level, because of either a premature birth or because of a illness or condition that we did not know that we had. I actually had a friend of mine that I went to high school with. She carried her child for 9 months and was delivering, and she found out during the delivery that she had a medical condition, and she had to be rushed to the emergency room for a delivery, a quick delivery, and she was actually placed on life support for a couple of months. And this young lady has a family. She is college educated, and she did not know that she had a chronic health condition prior to her pregnancy.
Wow.
But again, it just shows the lack of support that we have, and then also the disproportionate like illness rate of illness and disease and death specific to the Black and Brown community, unfortunately. But yeah, so there's a lot of mistrust.
Yeah.
Yeah.
And you talked about that. It made me think about Serena Williams. Now, here's Serena Williams. Everybody knows Serena Williams. We definitely know that she is affluent. So we know she's educated and we know who she is. And when Serena Williams has issues with childbirth and she's telling folks something is wrong, I don't feel right, something is wrong, and she was ignored to the point where it put her health in danger before someone decided to listen to her. So again, I'm glad that you said it. It has nothing to do with class, because racism happens at all levels, at all socioeconomic levels. And it's important for us to know that and to understand that. And for folks to understand, this is why there is a lot of mistrust with any type of social services, medical care. One of our folks in Fayetteville, Angela McLeod Tatum, does a fantastic job. So she's a doula and a lactation specialist, and that's her whole thing is about Black maternal health and childcare. And she's doing it up. I love the work that she's out there doing, but that's her focus. And I think when folks go back and they read the history and understand that this is what's going on, they say, oh, I didn't know that. But again, that's why you have to educate yourself. That's why you have to educate yourself. This conversation has been wonderful. I just hope that young folks out there that are thinking about going into a helping career, do consider social work and do understand, as Karen has shared with us, that social work is broad. It's not just working with Department of Social Services. It's not those stereotypes that some of us grew up with or that we see. And you can work in so many different environments as a social worker. She happens to work with public health. We have school social workers. We have people that work with other agencies. So think about that, folks. There are so many different ways, pathways that you could go into social work, and then she's also teaching. So she gets to do two things at once. She actually gets to experience the satisfaction of doing the work herself and then also passing it on to other folks. Mm-hmm. So best of both worlds in order to do that. Definitely the best of both worlds. Yeah. Well, you guys know me. I always like to make sure that we have a book that I can share with you. Again, as the chair of the Cumberland County Public Library and Information System, I'm all about literacy. And I think it's important for our young folks to read and to learn and to just have exposure to all kinds of things. Just remember, the library isn't just for books. They have magazines, they have videos, they have so much. And even though the library is currently closed, you can get curbside service. I get curbside service, every other week. I'm picking up a new book just about. I actually have one I have to take back now in exchange for another one. But the book I want to share with you tonight. So usually I do adult books, but this is one for young folks. So this is one. It's the Black Panther novel about Shuri. And those of you that watched the Black Panther do know that Shuri was the Black Panther's younger sister, the one who was a tech whiz. So this girl was into STEM. So what I want folks to do, if you're looking for a book for a young female in your life or a young male, and you want them to see a positive role model, this is a great book. Again, Shuri, and it's by the New York Times bestseller, Nick Stone. Nick Stone is actually a children's writer. So she has been writing these, some of the Marvel books. So again, that's one I definitely want you to read and to give as a gift. So Karen, what advice would you give to a young person who wanted to go into social work? What would you recommend for them?
I would definitely recommend that they try to pick out a mentor first. So someone that they know that may be a social worker, or even asking the guidance counselor if they can connect them with their school social worker or someone else that is in the social work career field. Doing research also. You can Google social work and see what social work is. Definitely check out our national website, the National Association of Social Workers. That will give you a lot of information about social work and the different areas of social work, practicing areas that social workers are found in. Gives you resources, just a ton of information. And also it will direct you to schools of social work or departments and programs of social work. So for those that are interested in pursuing the degree of social work, you can find what school may best meet your standards and qualifications. So I would say start with that. Do that and find someone that you can connect with and that will be your mentor, and that you can have some experience either volunteering with someone or potentially looking at doing some type of internship as well. And I do not mind being a mentor. I enjoy mentorship and also just sharing what I can with someone younger than me, because I think that's important too.
Okay, so if someone wanted to reach out to you, is there a way they could connect with you?
Sure. So you can connect with me via email, and my email address is K McLeod, my last name, all lowercase, 08@yahoo.com. And just send me an email, and we can set aside some time to chat a little bit further, and then see what your interests are and how I can connect you. And I have a wealth of also social work colleagues in different areas. So if the area that is of interest to you is different than mine, I have social work colleagues in all different areas. So we will find someone that best meets your fit.
Okay, so I'm putting this on the screen now. So for those of you who are interested, did I spell it right? No, I didn't.
McLeod 08. Yep, you did.
Okay, I did. All right. So if you are interested in reaching out to Karen for more information or a possible mentorship, this is her email. Karen, this has been a fantastic conversation. I haven't seen you in a while because, with COVID and then you're up in Durham now and still here in Fayetteville. And so, we used to see each other at church. I've actually kind of changed churches. So we don't see each other there anymore. But I really thank you for your time, because I think, again, it's so important that young folks see folks doing things so they can see their possible selves.
Yeah.
That is one of the most important things to me, that people, you can't be what you don't see.
Right. That's so true.
So I thank you for being here. We have a last comment from Debelina. She said, "This is incredible, and thanks for a great conversation." Debelina, thank you so much for joining in. I really appreciate this. And for those of you that are coming in now or are finding something of interest, please make sure you share this out with people. Share this out with the young folks that you know, because it's really important that they understand that it's important to do your research ahead of time. Start finding out about those different occupations and what have you, because it is something that, you can find this information, but you've got to go out there and do it. You got to do a little bit of research, don't wait till the last minute, but go out there and do it. So again, thank you so much, folks, for joining in. Karen, thank you for joining in. And anyone that is interested in getting the monthly newsletter, well, we have some information in there. This is the URL in order to get my monthly newsletter. So there will be college and career information in there. There's usually some scholarship information. So again, make sure you do that. And for those of you who have not gotten your library cards yet, you can still get your library cards electronically. All you need to do is to go to the library's website. This is the URL. The librarians there are fantastic at all 8 branches, and they will definitely be there trying to help you out. So again, thank you everyone for joining in. Karen, hold on for a second. Everyone, stay tuned next week. We will have another college and career conversation with Dr. B. So I hope you join me next Monday. Take care, everyone, and have a fantastic evening.